Good afternoon, everyone. My name is Timothy S. Jackson, and I'm the Senior Director of Policy and Advocacy for AIDS Foundation of Chicago. AFC, alongside sponsoring partner Veith Healthcare, is proud to present its 2025 Fall Policy Fireside Chat webinar series, A Positive Way Forward, featuring people with lived experience and policy experts breaking down important topics related to HIV policy each week, including aging with HIV, harm reduction, HIV prevention options among marginalized communities, LGBTQ plus discrimination, and leading with racial health equity to end the HIV epidemic, which is what we're going to be talking about today. I am so proud to serve as moderator of today's final fireside chat, Getting to Zero, Leading with Equity and Ending the HIV Epidemic, where we will discuss how HIV-related health disparities and inequities disproportionately impact certain populations and lead to higher HIV transmission rates and poor health outcomes. Additionally, we will discuss the importance of centering and engaging community in efforts to end the HIV epidemic among those most impacted. Before we begin, I want to share a couple of points of housekeeping. During the program, everyone will remain muted. AFC is recording this session and we'll be sharing it out later today. The chat and Q&A will be monitored during the session for any questions that may arise, and we hope to leave some time towards the end to answer some of those questions live for you today. I would love for you all, for those that are already on the call with us today, the webinar with us, to introduce yourselves in the chat, your name, your affiliations, where you are joining us from. We would love to kind of see where everyone is joining us from. Now that we've done all of that, I am so pleased to briefly introduce the panelists for today's webinar. And for the sake of time, I'll just list their names and affiliations and short biographies, and I encourage you to read their full bios, which are going to be placed in the chat and are online as well. We will first start with Judith Montenegro, joined the Latino Commission on AIDS and their Latinos in the South program in 2013 as their Director of Community Organizing, and in 2016, she became the program director. As a Mexican immigrant living in North Carolina, Judith is passionate about working with immigrant populations, focusing on immigration reform and improving healthcare access for Latinx communities. She has served on the boards of directors of the American Heart Association, Durham Central Park, Alianza Americas, and El Centro Hispano. She is currently a board member of El Vínculo Hispano, and I hope I'm saying this correctly, and serves on numerous advisory committees. Before joining the Latino Commission on AIDS, Judith was a paralegal, focused on medical case management and workers' compensation claims. Let's welcome Judith. Next, we have Marnina Miller, who's a highly accomplished human rights activist, speaker, trainer, and social media strategist with a profound commitment to fostering positive change in society. Marnina is honored to serve as the co-executive director of Positive Women's Network USA. Marnina's journey with Positive Women's Network USA began in 2017 when she joined the local Greater Houston area chapter. Under her brand, Marnina the Queen, she harnesses the power of social media to address social injustice and spread awareness of critical issues that impact people living with HIV. With an impressive following of over 100,000 followers and millions of video streams across platforms like TikTok, Instagram, and Facebook, Marnina is a force to be reckoned with within the digital realm. Her expertise in HIV activism has garnered significant recognition, leading to features on prominent media outlets such as Vice News, National Public Radio, NPR, and the YouTube original series HIV Disclosure and Dating. Let's welcome Marnina. And finally, my colleague Meg McElroy is the Director of Special Projects at AIDS Foundation Chicago, where she leads statewide efforts for Getting to Zero Illinois, a public-private partnership working to end the HIV epidemic in Illinois by 2030. In this role, Meg advances equitable systems-level strategies while centering the voices and experiences of communities most impacted by HIV. Previously, Meg served as Senior Program Director on the advocacy team at the ACLU of Illinois, where she led a dynamic policy team in developing and executing a legislative agenda grounded in coalition building and community priorities. Meg's professional background is rooted in both clinical practice and advocacy, with focus on maternal and infant health, LGBTQIA plus well-being, and gender equity. Meg is committed to building more just systems through policy, partnership, and the power of community. Welcome, Judith, Marnina, and Meg. Thank you all so much for joining us. And as I mentioned, all of those biographies have been placed in the chat, and you can find those online at agechicago.org. And I think before we begin, first of all, thank you all so much for joining us for this last conversation in our webinar series. But before we begin, I think it's important that, as I've done with the previous 5 webinars, is really grounding our conversation with their initial thoughts on the current state of affairs here in the United States. But I'm going to change things up a little bit. Whereas I in the previous 5 have been asking what does a positive way forward look like, given kind of the chaos that's going on in the world. I would like for you all to kind of start with what does getting to zero look like for the communities we serve, especially amidst the chaos with HIV funding, government shutdown, millions being kicked off Medicaid, executive orders, all of the things. So who wants to start? Let's start over with Judith.
I knew that was going to happen. Well, good afternoon, everyone. I'm excited for this conversation because I think in grounding some of the work that we're doing and thinking about what the front lines look like and the policy needs that we need, I think we have to go back to the original intentions of the ending the HIV epidemic plan and thinking about all the threats that we're seeing to being able to diagnose, to treat, to prevent, and to respond to the HIV epidemic. And so for the communities that we work with, we are definitely seeing that some of the in order to get to end the HIV epidemic, um, we know that there's a lot of confusing information happening. And the design of these executive orders, the design of even the rumors of future and potential policy of what may come down the line, seeing that states are following suit and fast forwarding some of the federal policies, we see that there's a real need to safeguard. And where we failed as organizers prior to this moment was codifying a lot of things, right? And making sure that communities were the most protected. Um, we're seeing more limited access to culturally and linguistically appropriate care, right? In terms of testing services, especially in rural and immigrant communities, because of things like executive orders on English is now the language of the United States. We're seeing data not being safeguarded, right? And being shared across different departments. And so being able to rebuild some of the confidence in medical providers, being able to rebuild the trust by communities in some of the institutions that we continue to encourage people to seek, right? And to getting tested at the health department, to providing their data. I think that as we look at these cuts, looking at all of the work that Ryan White and ADAPS have accomplished throughout the years, we're truly seeing that in order to move forward, some of our states need to pave the way for some of these responses where the federal government is failing. And it's important to name to community how to work collectively to protect the services that we desperately need, right? And so we want to make sure that communities first have the medications that they need, right? I think being able to put some of these policies in place to safeguard folks' care and treatment and protect providers providing these treatments, especially to folks who are receiving gender affirming care or life saving um, chronic health condition care. We need to look at how these systems were able to fail certain communities and how we can make changes in the future.
Thank you so much, Judith. Let's toss it over to Meg.
Yeah, I mean, I couldn't agree more with everything that Judith said. And Tim, thank you for having me on to talk about kind of what we're doing here in Illinois. I think I'll just add getting to zero. You know, we've always had our goals of like how do we reduce new HIV transmissions and make sure that folks are achieving viral suppression if they're able to, in order to change what our numbers look like, right? When we think about the HIV epidemic, we're really data driven. But really, at the end of the day, getting to zero for me is about like how are we creating belonging, stability for our communities? How are we creating dignity so that people are able to lead like full and healthy lives? And so, yes, our systems are being attacked, but how do we make sure to focus on people's lives? Yes, we need to talk about medication. We need to talk about data transparency and data, and we need to be driven in science because people's trust of science has just been so eroded. We have to show up with timely data and real facts for people. But I think when I think about getting to zero, it's like, how are we making sure people are able to lead really joyful, healthy lives with or without HIV? And so I think a part of it is like, yeah, how do we, for us in Illinois, it's like, how do we protect Medicaid? How do we make sure people are able to stay enrolled in their health insurance coverage, whether that's private health insurance or Medicaid? How are we protecting bodily autonomy, not just for HIV, but saying, look, if we start to erode our bodily autonomy, the choices people are able to make, that will come for the HIV space. It will just be a moment or two until we see that start to attack people's ability to make choices about their health and their body. And how do we protect our trans siblings and our queer family here in these spaces? So I feel like when I think about getting to zero in this moment, I have a lot of hope amidst everything that's going on. It's horrible. The landscape is hard to look every day. We are under attack from a different angle. But getting to zero gives me a lot of hope. There's a very clear roadmap here in Illinois with the plan we have in place. And that roadmap is really challenging in this moment under threat, but it gives me hope. But I also want to be really clear. I hate to bring it down in this moment. I don't want to be here like this toxic positivity around, like, we will have people die under the current administration, and we have to be really real about that. Our systems are being decimated, our systems are being attacked, people will die unnecessarily. And so it's like how the work that I feel like I'm doing, and when I've been in community doing this work, it's how do you hold both of those things at the same time? How can we find joy and hope together and also recognize like we have a lot of work to do because we're under threat in this moment?
Thank you so much, Megan, and thank you for bringing it to the realization and to the forefront about being real and let's being honest about all the things that are at stake right now. Marnita, I let you get the last word on what does getting to zero mean for our communities, given all that's going on in the world.
Well, I want to first thank you, Timothy, for asking me to be on this extremely impressive panel of women, I would add, that are really working in the HIV epidemic. I want to first say there are already people dying. And to what my colleagues stated, it is so real. We know that because of this erosion of USAID and PEPFAR, our siblings globally are dying that are living with HIV. I'm a woman who's been living with HIV for the past 13 years, and I came into this space as a youth organizer. And I also want to be real, we can't end the HIV epidemic when the same systems meant to protect us are still harming us. We're living through a time when our public health is being defunded and politicized, where DEI, another code for just black and brown, is being erased. We're seeing reproductive justice under attack, and queer and trans people are being targeted for simply existing. And these aren't separate from the HIV movement. They're all interconnected. They all have intersectionality attached. And so ending the HIV epidemic can't just be about viral suppression. It has to be about liberation and healing and safety for people living with HIV. And so when we talk about ending the HIV epidemic, I also like to pair and to enhance the quality of life for people living with HIV, because there are 1.2 million of us that are already living with HIV. And if we talk about ending the HIV epidemic, and we rarely talk about what happens when we do get to zero. Are we then also going to be making sure that the lives of the folks that are living with this virus are already protected as well? And so to talk a little bit about some of the policy issues that are impacting us, we know that harmful legislation that came down from the big murder bill And we know the executive orders that are harmful. And one I wanted to really talk about was Executive Order 14168, Defending Women from Gender Ideology, Extremists, and Restoring Biological Truth. This order is directly targeting and making our queer and trans siblings targets of the state. And so, as we are going out throughout our discussion today, I just wanted to add that layer of nuance. And I know it may be sombering to hear, but it's the reality in which we're living in. And so, I want to make sure that I am basing my statement, like Meg talked about earlier, in truth and possibility and hopes for liberation, because I do believe that liberation is possible while we're still here.
Absolutely, and thank you so much for bringing that to the space, Marnina. Those harmful executive orders, like we mentioned, obviously that one specifically in several of the previous webinars. We could literally spend another 6 webinars talking about that one. Just it's ridiculous on its face. I do also want to highlight, because I think I saw him in the chat also earlier too. All 3 of you all kind of alluded or specifically directly mentioned kind of the threats to funding. Obviously, all of the things that we're talking about doing what our communities need, can't really do it without money. And whether that is here, domestically or whether internationally. And so I know there is the Save HIV funding campaign that is going on. And we just place that information in the chat. If you are not familiar with that, please go to that website and you can find information out about that. My colleague Max Boykin, I believe, was in the chat earlier. And so they're doing tremendous work in really getting the word out about making sure we protect our money for all things HIV. So I did want to highlight that. The next question, and this is for all of our panelists, is one of the things that is important to me too is, and I think it's important to all of you all as well, is hearing directly from the front lines, from community. Because I think sometimes we can kind of get in our echo chambers and us going about doing the work. But what are you all hearing as leaders in this space? What are you all seeing on the front lines? What are you all hearing about the most pressing issues from community right now that impact our work? Let's go back to Marnina.
I saw Meg come off. I want to hear from Meg first.
I was gonna say,
Let's go with Meg.
I'm ready. No, I'm ready for this question. So, for folks who aren't aware, here in Illinois, Getting to Zero did AFC led a statewide summer tour in the month of August. We traveled 2,200 miles around the state and got to meet with people in their communities. And time again, the thing that came up in so many ways, in so many statements, was access to healthcare. People are terrified about Illinois is an ACA expansion state. So many people have their health care right now, and people are terrified about losing their health care. And folks who have health care are terrified about how do they keep it? How is it going to be affordable when prices rise and structure changes? And so I think that was the biggest thing. And I heard providers, I was chatting with a harm reduction group in central Illinois who was talking about, we offer HIV screening to everybody. They're street-based work. They're meeting people where they're at in the middle of active addiction. And they were like, we'll have people refuse to be tested because they don't have health insurance and they feel like it is a referral to nowhere. If they have a positive test, what are they going to do if they have no primary care provider, if they have no access to health care? And so it was just so gripping and moving that is the umbrella that, like, how do we even begin to address some of the other pieces when people are so terrified, rightfully so, understandably so. We know what is coming after the midterms. We know what is coming down the pike when we think about Medicaid access. And so that to me is the biggest thing, that the biggest hurdle that's on our plate. And the thing that was most prevalent on our tour was, how are we making sure folks have access to care and remain engaged in care when they do have access, and really protecting that infrastructure.
Thank you so much, Meg. Marnina?
Thank you for this question, Timothy. What we're really seeing on the front lines when we talk to our members at PWN is about housing. The
Mhm.
housing crisis in this country has disproportionately impacted people living with HIV. And so you can't talk about treatment adherence or viral suppression when people don't have a safe place to sleep. So, as you know, and we all know on this call, that housing is healthcare, and every policy conversation that ignores that is already failing the people that we serve. And so, we really need federal and state investments in long term, accessible, and affirming housing, especially as people living with HIV age, not just as temporary fixes. And then there's also healthcare. Access isn't just about the coverage that we have, it's also about the trust in the systems. And we're watching hospitals close. We're seeing Medicaid get cutted. And medical, and I like to call it distrust, is here. And has even deepened during these times in Black, Brown, trans, and queer communities who have every reason to be cautious. And so public health systems need to earn that trust by providing care that's culturally competent, but also that's rooted in trauma informed care. Because I remember accessing services for Ryan White early on in the days of my diagnosis. And I remember being so nervous about accessing those resources. And when I did get those, it didn't feel trauma informed. Nobody asked me how I was doing. The person just had their head down in the computer. And I remember though, yeah, just
Yes.
typing
Yeah.
away. And I remember feeling so isolated in that moment. And so my last point is isolation. So we're seeing a large need for people to
Mhm.
be in community. PWN offers so many different programs for people living with and vulnerable to HIV. And so what we're seeing is a massive need for our Sister Circle program. It is a space bi-weekly that PWN hosts, and our members host that space. And it's just a space to come as you are, a round table, just to have solidarity and sisterhood. And so we're seeing an increased need. We've seen like a 3 time jump increase in folks attending those programs just to have a place to decompress. And so I also say like that's a deep need for people, because as we see how our folks on the ground are being overhauled with so much information, so much harmful legislation that's coming down the pipeline. And so folks are needing spaces to be in real community and comfort.
Wow. Wow, Marnina, thank you so much. That need for community is something that has repeatedly come up in the previous webinars. These kind of third spaces for people to kind of just be together. It's more prevalent now than ever. Let's toss it over to Judith.
Yeah, I think what Meg and Marnina have shared around housing and healthcare access mirrors a lot of what the communities we've worked with talk about. But I think that for the communities that we work with the most, which are Latina and immigrant communities, some of the biggest concerns um, is some of the reversal of policies happening that would have provided um, public benefits
Mm,
and also protected communities. So we're seeing ICE in schools and churches and hospitals and places where before um, there was an understanding that they would not be in because they knew that communities needed these services. There's a lot of disinformation fueling stigma around HIV and immigrants. We saw the vice president make comments about Haitian immigrants, right? And so these comments about the HIV epidemic, comments about immigrants and who they are and reducing people to a condition, reducing people to being criminals, reducing people, right? And being able to treat people this way so publicly, having the airports and our televisions screen commercials encouraging violence against
mm,
their own community members um, is a major concern. We've also seen that a lot of this has fueled a lot of discriminatory and anti-immigrant legislation at the state level. We're seeing more states engage with ICE in new ways with law enforcement and lean into the criminalization of individuals. And so for our communities, there is a lot of fear in engaging with systems. And the other concern is that because we're having um, these very one-sided conversations, the messaging from the other side is loud. We saw an increase of Latina voters voting for a Trump administration, right? Because they have been able to infiltrate communities in ways that we're not seeing Facebook or YouTube or some of these other social media outlets where a lot of Latina communities obtain information. A lot of churches co-sign the the information that the Trump administration is sharing, spinning what these policies look like, right? And not really understanding the implications that these mean for communities. And so we're at a place where there are communities who are experiencing a lot of violence in being unable to access healthcare, violence being unable to access housing, violence in feeling safe in their communities and driving to work and being with their children. And then a we also see like an increase of support for these activities in some communities of color. And so creating these third spaces, like Marnina mentioned, creating spaces where people can be in community, be reminded of what it's like to care for one another and for why it's so important for us to be together in this moment and organize is essential. And it's an investment that some of our organizations have had to pull away from because they're focusing so much on being able to get services to people, being able to get medications, right? A lot of this is strategic and planned to keep people from being together and being reminded of the need to care for one another and not normalize the violence that we're seeing.
Yeah, thank you so much, Judith. I think you're spot on, talking about some of the issues that we see around immigration. Lord knows here in Chicago, we have been seeing it kind of front page daily, with some of the chaos that's been ensuing around that. I want to say with you, Judith, because I want to ask a kind of a follow-up question because it's as people deal with potential immigration, Marnina mentioned kind of isolation. How do we begin to pivot to continue to reach communities that we still need to? Because ultimately, one of the things that I've said, all of the things are going on in the world, right? Community still needs our help. And so how do we continue to do that? And so, Judith, can you share what are some concrete ways to reach people in their own spaces, rather than assuming that they're quote unquote, my favorite word, hard to reach? And how do we kind of utilize informal community gathering spots for outreach and education?
Yeah, I think that I think this push for isolation we've seen for a long time, especially at the start of COVID, right? We saw that it was harder to come back together, even in spaces virtual. Like our lives changed. Now we're always on Zoom. I haven't picked up a phone to call someone in so long. It's always on Zoom, and there's something that happens that is impersonal. So I think in order to um, think about how we can reach people in their own spaces, a lot of organizations, a lot of us need to understand who is really being impacted, right? And understanding who our staff and clients are. And I mentioned staff because often our staff, we don't think about our staff as being impacted, and they are, right? We have staff who have DACA, temporary protected status. We have folks on staff who are refugees, who have come from mixed status families, who are experiencing homelessness themselves, who are living with HIV, and being able to map out the resources needed and identifying some gaps is essential in how we think to respond. And thinking about which folks need the most rapid response, right? And where we see more emergency response needed in case something happens, right? In case someone loses housing, being able to identify, these are the folks that we need to look out for the most. How do we connect them with services immediately? I think that a many of us have gone through know your rights trainings, right? Creating safety plans ourselves, but making sure the communities that we work with and are most impacted are also going through that, right? Going through their own know your rights, knowing your rights at a healthcare level, right? What information do you have a right to? What does that relationship look like with your provider? And being able to grow in some of the partnerships with more diverse partners. We're doing some work in Louisiana because there was a slew of anti immigrant legislation that would impact Ryan White and the AIDS Drug Assistance Program. And we're working alongside with the Positive Women's Network in Louisiana and an organization working with refugee and immigrants to making sure that we're connecting folks around these issues and finding ways to work together and creating safety plans, because I think some of the isolation that comes from fear has to do with a lack of planning and strategy, right, in community. And so being able to assist with that, we also want to encourage communities doing this work who are having a hard time connecting with communities is to publicly state your commitment to community. I think that often we tiptoe around what's happening and we don't say it outright, right? This administration is not transparent. They are creating mistrust. We need to recognize the violence and call it what it is always, so that we do counter some of that messaging encouraging isolation, and being able to recognize what the root causes of migration from a transnational perspective. And I think Alianza Americas, and who's based in Chicago, does an amazing job of talking about that, of talking about how the histories that our communities and our families come with shape some of the policies and politics that we work in. I think as we also think about how we connect with communities, if you are not community connecting with communities in their language, I think that is um, a place where, when we think about the meaningful involvement of people living with HIV and the just involvement of people living with HIV, we often leave out monolingual Spanish speaking communities and monolingual communities who speak other languages in some of these organizing spaces. And so it's a reflection on the HIV movement to move towards providing more linguistically appropriate services, and I'm proud that the Save HIV funding is translating some of their information, so that'll be available for more organizing power in communities and ways for us to connect around these conversations. We often try to cut budgets around some of these things, around translation and interpretation, but it's when we need it, and we need it to be the most vital. We saw this during the COVID pandemic, where health departments were putting out, you know, a I don't know how to say this without cussing,
Yeah.
information that wasn't a accurate in Spanish, and it created more disinformation. Like, the intention was to provide, but because the investment wasn't there, communities don't know where they're welcome. Bilingual signage, changes things. Being able to navigate spaces changes things. Having clear information definitely changes things for communities to be able to access these services and to feel more welcome. I think when we think about going into and going into communities that we often, that we think are hard to reach. They're not. They're not hard to reach. You're just not going to places. I've seen organizations in Alabama include voter registration as part of their intake forms at children's clinics, right? Like, this is how we connect with community and find folks, is being able to um, find unique ways to have these, or incorporating these conversations with communities at all levels.
Thank you so much, Judith. And you're absolutely spot on with all of your take. I'm gonna toss it over to Marnina and highlight something that you mentioned a little earlier. You were talking about community mistrust in healthcare spaces, and so obviously that impacts our work in ending the HIV epidemic. So how do we address community mistrust in the healthcare public health systems, which historically has been shaped by factors such as racism, misogyny, misogynoir, transphobia, all of the things.
The trifecta of isms.
Yes.
So the Trump administration, it's funny, but it's not.
Yeah.
And honestly, I really love the word misogynoir. It kind of rolls off your tongue, but if y'all have never heard of it before, it's how misogyny disproportionately impacts people at race and gender, so Black women, and specifically talking about the misogyny of Black women. So I want to kind of lay the groundwork for what this question really is shaping to be. The Trump administration is truly achieving what they have set out to do. They wanted to make America great again for white cisgender men. And so that's exactly what they're doing. And so if you're not a white cisgender man, the medical care system wasn't created with you in mind, because when we talk about all of those different intersections, we have every reason to distrust these systems. This isn't some irrational fear. It's not a lack of education. It's a lived generational truth that's been passed down because what has been done to our bodies, our communities, and our families. And the history is very clear. This country has used indigenous and enslaved bodies as experiments for years, from gynecological surgeries performed on Black women without anesthesia to the sterilization of women and AFAB folks living with HIV at the beginning of the HIV epidemic, and to the forced sterilization of my sisters and siblings and the indigenous folks that were Puerto Rican. All the way down to the Tuskegee study and to the ongoing denial of gender affirming care for trans and gender non-conforming communities to this day. So it's not without reasons why our communities do not trust these systems. So the question is, how do we get people to do it? How do we make these systems trustworthy? That's the work. And that's what it means to really fundamentally shift who holds the power and who defines what care looks like. It means we have to stop centering institutions and really start centering the people. It means that we have to stop doing outreach like ownership. It means we have to have research from communities that are led by us and for us. And so at the People Living with HIV caucus, we created Demanding Better, which is a framework to show folks how people living with HIV should be treated. And it reminds us that healing and liberation really start with the meaningful involvement, not tokenization of just saying I had someone living with HIV there, but it really comes from shared power and decision making. That same principle applies to every community that's been harmed by medical and public health systems. We have to design care that begins with telling the truth, which we've done today, holding folks accountable, and also with representation. And all three of them have to be aligned. We can't just have someone, oh, we got someone represented here. No, it has to also have accountability and also truth telling. And so we have to build spaces where people don't have to leave pieces of themselves behind just to be greeted at the door with dignity, because you can't heal people from what you refuse to see. And so you can't trust a community can't trust you if they've been traumatized and no one has acknowledged that. And so you can't end the HIV epidemic while the people living with HIV are still being erased. And so our communities need to learn how to trust. Um, but the systems also need to learn how to deserve it. And so we can't heal in the same systems that have really caused us harm. So as we rebuild these systems, because we know the Trump administration is dismantling our public health infrastructure. So as we rebuild them back, I think we rebuild them back with radical transparency, with representation and accountability. And that's how we really transform mistrust into meaningful partnerships.
Thank you so much, Marnina. And I think it's important to, um, and I want to make sure that I get this attribution right. I think it was Lisa McKinley Beach several weeks ago mentioned something that these problems that we are encountering did not just begin on January 20th, 2025.
Mm-mm.
And so it's important to bring that into space, what you were saying, Marnina, that these are historical issues that we're talking about that still impact us today. And so thank you so much for highlighting that. I'm going to toss it over to Meg. Meg, you're in an interesting spot with your role. You lead Illinois' Getting to Zero plan, which is a partnership co-facilitated by AIDS Foundation Chicago, the Chicago Department of Public Health, and the State Department of Public Health. Who should hold policymakers and institutions accountable for meeting equity goals, and what does that accountability look like?
Yeah, Tim, thank you for this question. It is a big one and a hard one. And one, I don't have a 4 or 5 minute answer that's going to be satisfactory for it. But I think in an ideal world, we wouldn't have to hold our systems to account. They would prioritize and embed equity because they're leading the work. But we know that that's not the system that we live in. Marnina has spoken really beautifully to the systems that are not built for all of our success. And we can see that play out. We don't need to dive into the data here, but we see it play out that HIV doesn't discriminate, but all of our systems that we're asking people to interact with absolutely do. And when we say getting to zero in Illinois, we mean getting to zero for everybody. And so AFC really takes it seriously that we have a responsibility to our residents across our state, to the larger country and HIV community, but to the residents across our state, that we must, in our role as a steward of this plan, we must hold our systems accountable and push for working from an equity lens at every single opportunity we have. And so I really think that comes back to our community and our advocates have to make our voices heard to our elected officials. It's important for us to make our voices heard to everybody, but our elected officials are really situated in an interesting place that they are often the ones who are putting forth and voting on programs and policies and the big one, funding. Nothing gets done without those dollars. And so we must push our elected officials to engage in that iterative process of not just one time voting on something or passing something, but then holding those systems that are charged with carrying forth those programs, hold them in an iterative process to come back to the table and say, is this actually working the way that we intended to when we came to the State House, when we came to City Council, when we met with the board? Is this working in the way that we intended to? And if it's not, we must address that. And so I think, it is community working in collaboration with policymakers. And guess what? We vote those folks into office and we can vote them right out of office. We're at a 501c3. I won't say more than that, but it's our responsibility as advocates and community members to make our voices heard, to make sure our elected officials know what our communities want and what our communities need. And then I think at the end of the day, it is our elected officials who are able to then ask the tough questions to our entities and our agencies to say, hey, how are we dispersing this funding? What are we doing? How are we making sure that the policy that we passed or the budget that we passed is doing what we want it to do? And if those folks aren't able to provide questions in the moment, Tim, you and I have both sat in committee rooms where it's like, we'll have to get back to you, we'll have to check back, kicking the can a little bit down the road. Then it is the responsibility of elected officials or their wonderful staff members to make sure that we actually get those answers. And I think, both Judith and Marnina have talked about transparency and accountability. And I like to think of transparency as like the twin that was born 5 minutes before accountability, that you can't have one without the other. And she's going to be the older, cooler sister that always has to enter the room first, because transparency, it pushes us to have accurate data. It tells us the truth about who's in the room and who's at the table and who is not. And it forces the conversation. And accountability is what we do next. What we do when we say we have that data, and now what do we do with it? We know who's at the table and we know who's missing, and now what do we do with it? And so I think we can't ever achieve true accountability within these systems and with these agencies, organizations within our government if we don't also have transparency.
All right. Thank you so much, Meg. Audience, we're gonna be wrapping up in just a few moments. And I do want to make sure that we leave some time for some questions. And it looks like we have a couple of questions in our chat. From Sarah, I'm gonna say Loesch. I hope I'm pronouncing that correctly. But the question is, our organization receives Ryan White funding and prevention funding from IDPH. If anything, which is Illinois Department of Public Health, if anything, we've noticed restrictions on prevention funding has increased significantly this year. Things that used to be allowable are being denied. It seems like our state health department is putting more barriers in place, limiting our ability to do meaningful prevention work on the ground. What role does the health department have in adhering to federal mandates while not restricting funding to the point that it is virtually unusable? Meg, do you want to tackle that one, or do you want me to tackle it?
We can take this in two parts. What a tough question. And I'm going to start with, I think, the humanizing side of this. I'm not giving a pass to our partners at the public health department, but Tim can kind of really talk to like what is the role in adhering to federal mandates without restricting funding. What I will say from a human perspective, and I've seen this both in the public spaces and private spaces, is that people are afraid that if they do one thing, like it is coming from a fear mentality, and I think a scarcity mentality, that it's like we've got to hold on so tight to what we have because we've seen the attacks that we are under. And so I think some folks, especially our more risk averse folks, are saying we've got to protect what we have. And so they're almost proactively, if you will, complying with things or taking steps and measures. And again, we're seeing this not just in our public health spaces, but also across our healthcare system. It's not right. It's not okay. We have to tell these systems, like, you still have those dollars and you still have that funding, and our communities deserve to have access to that. But I truly believe it's coming out of a place not of agreement with what is going on, but of scare, like of fear for losing any additional access to resources or to funding. But Tim, please speak to, adherence to federal mandates and that role, please.
Yeah, I think it is. It's, unfortunately, this is going to be the way of the world for right now. Unfortunately, for not only health departments but organizations as well that receive specifically dollars from the federal government. In trying to understand, how do you, one, maintain your ability to believe in equity and diversity, inclusion, and protecting LGBTQ communities, all of the things, while also receiving federal funding and understanding the blowback coming from that. And how do you really try to walk that very narrow line? And so I think that is something that the health department is dealing with. That is something that many organizations across Illinois and across the country are dealing with. I will be completely honest with you and transparent. Meg mentioned the word transparent. That is something that AIDS Foundation Chicago is dealing with. And how, what does that look like to make sure that, one, we're taking care of our community, but then also trying to walk that very narrow line. And it's difficult. And I agree with you. It's somewhat a self-fulfilling prophecy. Yeah, it's unfortunately, this is kind of where we are right now. Let's see, go over to the next question. Given everything going on, what's giving you hope and lighting optimism to keep your advocacy going? Let's do popcorn for that one. Let's start with Judith. What's giving you hope, Judith?
I think, and if I can just add something to the last question,
Sure, absolutely.
because we're seeing this in some of our states. We saw this in Idaho where there was a law passed in the state that specifically mentioned that Ryan White would not be eligible, that public benefits would not be eligible for immigrants, and it went against federal law. And so we saw an injunction be placed, but then we also saw some other laws passed across the Southeast, in Louisiana, and there was a bill passed in North Carolina that they're still trying to veto. We don't have a budget in North Carolina, so we got a lot going on. But a I think it's important to note that what compliance looks like and how we recognize when agencies are complying preemptively, and how dangerous it is to be doing that, because had some of our organizations started collecting data around immigration, had people, now you have the data, right? Now you own, now what do you can't not have the data, right? Like it's very hard that once you open the can of um like those biscuits that pop open, for you to be able to get them back in. And so what we're hoping that communities do is not email their health departments to ask about, should I comply? Like wait for instructions. Don't email them any, because then now they have the record. It's that biscuit. Um and so we have to be watchful of that, of how much we're asking, what spaces we're asking, how we can be in community also with health department employees and staff, and what conversations we're having online and when we grab coffee with them to learn more. And so it's about some of these relationships at this time. So I'll mention that sort of separately. For me, what's giving me hope is the amount of spaces for us to come together and work together towards defending um, so our work, and defending people living with HIV and defending our communities. I'll say that a lot of it is working. Often we don't talk about that. We are seeing successes, that states that sue, that organizations like AFC that sue, are winning. Like we are stopping some of this. We are creating barriers. We are making it harder for this administration to achieve everything. And so the louder that we are, I've seen folks being released from detention because we've been so loud. And so that's what gives me hope, is that hopefully there is an awakening of community members who more and more say, we saw it at the protests this past weekend, that more and more communities start to speak out in ways and about things that maybe they normally didn't, right? Maybe they weren't as engaged and may not be engaged after this, but that being able to recognize and speak out and saying, like, this is not what I voted for. This is not the nation that I hope to live in. This is not the communities that we've worked so hard to build. So how do we protect each other? The amount of mutual aid that we've seen, and organizations and communities picking up some of those models, I think is important. The way nonprofits are trying to change, because we've done damage too, right? Like we're part of the systems too. And it's important to recognize the roles that we've played, right, in lifting and holding up some of these systems that have been so damaging. And so seeing that reflection, these changes, the model, like folks are modeling something different, that's what gives me hope, is that I'm with Marnina. I hope that liberation is in our lifetime and that we can achieve it.
Meg and Marnita, for time, y'all have a couple of things that keeps you hopeful.
I can be brief in mine, and it's spaces like this. It's the connections, both Marnina and Judith have talked about isolation. And I have found when I have the opportunity to physically be in community or virtually create community and be in spaces, that is what gives me hope, because it's like they can't steal our joy. And it's a tough thing to thread, to hold both at the same time, the horrors, the human experience of the horrors of what's happening around us, and creating and finding spaces where we can celebrate and be together and have that joy in our lives. So the small answer, the short answer, it's the people, it's the relationships, it's the opportunity to be together and have joy with one another.
That's good. Thank you so much, Meg. Marnina?
I think my answer is definitely going to mirror Meg, community. And watching our people really move with purpose and intention. And despite the attacks on all of the things that are impacting us, we're still building, we're still mobilizing, we're still on these calls. We're still making sure that community hears our voices and that we're in community with one another. So whether we're virtually or in person, and we're having spaces like you mentioned earlier, Timothy, Save HIV funding and other spaces. Another thing that's bringing me joy is our ability to hire people. We just hired a young Black trans man and a young Black lawyer. And so those are walking examples of what it means to really move and lead with courage and authenticity, especially during these times. And we're releasing a mutual aid fund for our members. And so, as Judith was talking about how communities are thinking about how do we look at things differently? Historically, PWN is mostly policy work, but how do we move with intention to make sure that we are protecting our communities, because we know that we save us and we take care of us.
Absolutely. I'm going to ask one of our panelists to answer this question, because I don't want to leave this one question unanswered before we do our close, and being mindful of time. With an administration that is openly hostile to science, especially around HIV, how can the community and the HIV workforce effectively debunk misinformation that can increase HIV stigma and discrimination? Who wants to answer that one for me?
No, Marnina, please go ahead.
No, Meg, I was going to throw it to you. I'm really long winded.
Okay, short and sweet. How do we do this? We continue to, in a timely fashion, provide accurate information. For the opposite of all the garbage that's out there is not us coming out and saying this is not right, this is not accurate. It is providing and flooding the space with accurate information, timely information in an accessible way. So not only, Judith was talking about language access, not only like in a language that people want to take that information in, but also from the messengers that can and are trusted in those communities. And so I think that is what we do. It's not wasting a single moment of our time, waste some moments of our time saying this is not accurate. We know this is not true, but it is instead turning and saying, this is what we know to be true. This is the science-based things. And some of that stuff there are some people that we are never going to change their minds. They do not want to be convinced, but it's the people who are with us in believing in science, and it's those mushy middle people that it's like we have to continue to provide timely, accurate information in the way that people can hear it from people who they trust. That is how we dispel and debunk misinformation.
Thank you so much, Meg. Wow. Thank you so much both to Meg and Marnina and Judith for joining us today and for the tremendous work that you all are doing in our communities. Of course, y'all know that we have to, we can't give you all of this great information that our panelists have shared, but also giving you opportunities to get engaged in our work at AFC. First, we encourage everyone to sign up for our Policy and Advocacy Action Network by texting AFC to 40649. Text, we would love for you to visit our Mobile Action Center, participate in the various advocacy campaigns found there. And the link is being placed in the chat. We are proud to introduce our Positive Way Forward policy agenda that outlines the local, state, and federal policy initiatives that we will support and oppose over the next 2 years. And then finally, we encourage you to learn more about the organizations discussed during today's webinar with the links that are being placed in the chat, whether that's the Latino Commission on AIDS, Latinos in the South, Positive Women's Network USA, Getting to Zero Illinois, all of the things. Of course, AIDS Foundation Chicago, ViV Healthcare. Please find that information in the chat. Don't worry if you're not able to get all of that information down, because I will be sharing it in a follow-up email later on today. As we begin to close, this has been an amazing conversation on Getting to Zero, Leading with Equity and Ending the HIV Epidemic. We will email the information from today's presentation, the webinar recording, important resources, also as ways to get engaged, as well as a webinar survey. I am also going to send a final webinar series survey. Please, y'all, please fill out the survey. It takes less than 5 minutes. I also ask that you please join me in thanking our panelists, Judith Montenegro, Marnina Miller, and Meg McElroy. I encourage you to follow them on Instagram, which are being placed in the chat. Finally, I want to take this opportunity because I believe in giving people their flowers while they can smell them. I want to take this opportunity to personally thank a few people that have made this webinar series possible. Patty Conway, AFC's Communications Director, Livy Averick, AFC's Digital Communications Manager, Sarah Kenward, AFC's Senior Graphic Designer, Emilio Davis, AFC's Policy Communications Specialist, AFC's Policy and Advocacy Team, including Meg, Nadine, Kim, and Jackie, all of our outstanding webinar series panelists, as well as our friends at ViV Healthcare for sponsoring the webinar series. To watch all the webinar recordings, please visit our website at aidschicago.org. And on behalf of AIDS Foundation Chicago and ViV Healthcare, I'm Timothy Jackson. It's been an absolute pleasure. Thank you so much for joining AFC's A Positive Way Forward Fall Policy Fireside Chat webinar series. Have a great rest of your Tuesday. Thank you all so much. Bye.